In this video, I answer a question on why all the work to try to fix your posture doesn't seem to help get rid of all the neck pain and stiffness in the upper back. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a chronic pain treatment expert with over 15 years of experience, specifically for chronic neck, shoulder, and arm pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick disclaimer on these videos. I don't make them to entertain, but specifically for anyone that has been dealing with chronic neck, shoulder, or arm pain for at least 6 months. They've tried just about every type of treatment. They've been lied to, overpromised, and underdelivered by the current medical model, really in hopes of giving some real answers as to what is going on and get to the root cause of the problem to get some long-lasting pain relief finally. Now on to the video. All right, so this question came from Andrea on Instagram. Let's read it. I spend way too much time sitting and working at a desk for countless hours throughout the day and always have some low-grade type of neck pain and upper back stiffness. Some days are worse than others. The other day, I saw a photo of my neck and upper back from the side view, and I am starting to develop a granny hump, even though I am only 30 years old. I've tried everything you can imagine to try to fix the problem, from my desk setup to different types of devices, all kinds of stretches, and trying to be mindful of it all. But nothing seems to work. And by the end of the day, I feel exhausted from doing it all, and my neck hurts even more. Thanks for sending that question in, Andrea. And just a quick reminder, if you have any questions you want me to cover in this segment, please send them in, specifically if they're for chronic neck, shoulder, or arm pain, and you want some answers. And if I think my answer can help, I'll make you a video and get it out your way. All the information to do that is wherever you're consuming this in the description box below. But let's get right into it. So what am I going to cover in this video? First is, why does bad posture occur in the first place? Next, why does trying to fix posture not produce any long-lasting relief? What to do instead of trying to correct the posture, and when is the right time to start correcting posture? I'm going to talk all about posture this week. So what causes bad posture? It's kind of funny that Andrea said she's getting a granny hump. It's funny, but it also is very true. I'm seeing this more and more in the younger population. We just get a huge outpouching. You can see this graphic I have here, where we just spend our lives just glued to our devices, computers, very non-sedentary, just not moving as much as we should. So I talk about this stuff all the time. Up here in this top photo is this stuff called adhesion. So over here is what's called is when a muscle constantly gets like stretched and contracted. When this happens, it doesn't get enough blood flow. It doesn't get enough oxygen. Sends a signal to the brain. The body's like, hey, there must be an injury there. And then it starts to lay down all this nasty stuff called adhesion, like a glue that gets inside there, makes the area less flexible, makes it weaker. I also like to refer to it as scar tissue. A lot of people are like, well, how did I get scar tissue? I didn't have a direct injury. Sitting all day long in bad posture, staring at your phone, doom scrolling all day long. There's a lot of stress on these areas. They develop a lot of adhesion. Then over time, as that adhesion gets bigger and bigger, eventually it gets stuck to the nerve and creates what's called a nerve entrapment. Nerves are built with about 15% of like extra slack to keep them healthy and make their way through muscles. Over time, it gets stuck there, and it starts with some numbness, some aching, some burning, and some tension. But the problem that happens is when this nerve does get caught, the body doesn't like that. So it'll make some postural corrections to unload that area. And we see there's a lot of nerves, especially in the back of the neck, called the accessory nerve, the dorsal scapular nerve. You got some of the occipital nerves. There's a lot of things going on back there, and they all get jammed up with this adhesion and get stuck. So the body inherently just kind of ducks your head forward and then rolls your shoulders forward. Now you got the bad posture, but the posture is actually happening to work around all these other dysfunctions in there. And a lot of people have it backwards as they try to address it. So why doesn't fixing posture provide any long-lasting results? First is the tissue just isn't healthy. When the tissue gets all of that adhesion in there and then stuck to the nerves, I always say that's kind of like a cavity has set in, or like a lot of plaque, a lot of buildup in the muscles, same as like your teeth. And posture correction, I say, is a lot like brushing and flossing. It's super important, but once the plaque is set in and all the cavities, all the brushing and flossing in the world isn't going to actually fix it. It's actually going to make it a little bit more annoyed and a little bit more flared up. Imagine if you had a big, nasty cavity in your tooth and you're just jamming on it with floss and brushing it really hard. It would make that area really angry. And this is what's happening when you're trying to correct your posture and put yourself back in better places. The tissues aren't healthy. And then by the end of the day, as like Andrea was saying, she's just really tired. She's really beat up and it doesn't seem to be doing anything, but she's focusing a lot of her time and attention on there. It's just that she doesn't have the right tool to actually address it. Next is when you do some of those stretches, or you might get like a massage or an adjustment, or I don't know, like move around a little bit, you temporarily get some changes in the tension in the feel. So it basically plays a trick on your brain. In your spinal cord, you have this path called the lateral spinal thalamic tract, very fancy word, but basically it senses two things like pain and then also senses like vibration and movement. And essentially what happens is when you do a stretch, you're moving around, you do some stuff, it just kind of blocks some of that pain. It's kind of like when you shake your hand out when you jam it in the door, it's just temporarily blocking that pain. That's what's happening with a lot of those things because you're not actually making a real change in the tissue. Next is just that protective tension. Like I said, when those nerves are entrapped, those muscles are compromised, your body's just going to roll forward. It's going to pull your shoulders forward. It's going to pull your head forward. It's trying to help get you out of that situation, which in turn is bad long term. Your body's only thinking short term, like, hey, this isn't working properly. Let's just hike our shoulder up and move it forward to take the pressure off of there. But then over time, puts more pressure on your discs and your joints and everything in your body, and you get a lot more problems building up. So, what to do instead of trying to fix the posture? First is start by getting the tissue healthier with specialized treatments. That's exactly what I do and what my providers do. We are experts at finding and fixing nerve entrapments and adhesion. And the thing is, I get a lot of questions about this, like, well, can't just like regular massage get this, or deep tissue massage or cupping or anything like that? No, what it actually needs is proper depth, proper tension into the area, have you go through a full range of motion. It's a very precise and very focused type of treatment. I say we're kind of like the dentist going in there and drilling out the cavity, very focused. You don't want the hygienist going in there and trying to drill your tooth out because they don't have the skill set to do that. So our providers are very highly skilled, specifically in neck and shoulder problems as well. That's all they work on, and that's what they're very good at treating. Next is just take some breaks and be a normal human. You know, if you're sitting there and you're, on your phone for, 27 out of 24 hours a day, you're slouched on the couch, you're slouched at the computer, like get up and move around. Like you always let people always like, oh, I don't have time to do this. I'm like, what are you really getting about scrolling on your phone all day long? Get up, take a break, be a human, drink some water, go outside and get this stuff called sunlight. It'll really help too. And just take some breaks, throughout there. I always say a rule of thumb that I have is like, if you're going to be sitting for 50 minutes, you owe at least about 10 minutes of either laying down or going outside and walking to kind of mitigate some of the force that's going from sitting and looking down all day long. Next is after you get the tissue healthy, you need to begin to build up the mid back area. It's such a dysfunction. I call it like the thoracic spine. It's basically from the base of your neck to like the lower parts where all your ribs attach. And it's so just beat up and overused and loaded up with adhesion and scar tissue in pretty much anyone in modern day society. And once you get the tissue cleaned up, then you want to build it up. And I'm a really big proponent on what's called pull workouts, where you're bringing things back and strengthening up the posterior part of your back. I also really think rucking is a really awesome thing. If you don't know what rucking is, it's basically where you wear a weighted backpack, but it kind of distributes the force around your torso and your mid body. They have weighted vests, but that puts a lot of pressure on your neck and not as good for people with chronic neck issues. I'm seeing rucking is just a lot better. It's something you can do, for a good amount of time, get some good exercise, but you're not going to really beat your body up. And it's going to really just help you bring those shoulder blades back and be in a much better posture and sit better too once you get that tissue healthy. But you got to get the tissue healthy first, because if you don't get the tissue healthy, all the workouts in the world are just going to make it angry. So when is the best time to start correcting the posture? Pretty simple. After the tissue is healthy and stronger, then those things are good. I mean, you should always be watching yourself with your posture. You shouldn't just be staring at your phone all day like a zombie, but you got to get all those other things better first, and this is where Andrea was having the frustration when she sent in the question. She's like, I'm doing all this stuff, but it's not working. Yeah, that's insanity. Doing the same thing and expecting a different result. Got to get the tissue healthy first. Like, think about this. You got to go to the dentist, get that tooth drilled out. And then good posture and good movement is like brushing and flossing. It's going to keep things better, keeping you from having to go to the dentist as often. Then maybe just go every once in a while and get like a deep clean, get the tissue cleaned up, because in modern life, you're going to accumulate some adhesion. You're going to get nerve entrapments, but if they can get them early before they're painful, it's a lot better and prevents a cavity. Like talking about analogies all day long, and everyone understands teeth. It's the same thing that happens with your muscles. That's all I got in the video. If you do need help, click the link in our profile to learn more about our new injury treatment process that provides long-lasting pain relief and better flexibility for chronic neck, shoulder, elbow, and wrist injuries naturally, non-surgically, without the use of medications, injections, or surgeries. All the information to request help or find one of our awesome Peak Method trained providers is in the description box below or wherever you're consuming this video. I appreciate you watching, and I'll catch you on the next one. Bye.